There we go. Okay, welcome everyone to the third of our departmental seminars at the International Development Department at Sussex for 2022. This week we are very privileged to have Lutfun Nahar Lata from the University of Queensland with us. Lata is a postdoctoral research fellow at Queensland who's published widely on urban inequality, the right to housing, gendered experiences of informality in public space in Dhaka. And her recent published work has examined how the mobility and livelihoods of slum dwellers and street vendors is managed by private gated communities and how access to public space and livelihoods is constrained by officials who seek to govern a clean and orderly city in Dhaka. Her recent, very recent published work shifts to look at the experience of informal workers and rural urban migrants under lockdown conditions, looking at collective life in the urban centres of the global south. And today, Lata will be speaking on Bangladesh at 50, Covid-19, pandemic governance and uneven citizenship. And I will be joined in sort of co-chairing and the discussant role by Professor Anke Schwittay, and the co-convener of the seminar series, Sarah Jane Feeler, is also here. So it's getting quite noisy outside my office, so I will mute myself and hand over to Lata. Thank you very much.
Thank you, Paul. Good morning and good evening, everyone. Thanks for coming to my presentation today. And I would like to especially thank Paul, Anke, and Sarah for inviting me to talk about my research on Bangladesh. Also, thanks to Tim, my supervisor, who joined us. So I would tell a little bit background why I kind of started with Bangladesh at 50 title. So Bangladesh got its independence in 1971, and then last year we were celebrating Bangladesh's 50th anniversary. And so I thought it would be good to kind of review a little bit while talking about COVID-19 and citizenship and what happened in Bangladesh over the years. So very briefly, Bangladesh at a glance. So the capital city of Bangladesh is Dhaka. And the population is 163 million. It's a lot of population for a small country. So population density is really high, 1,000 persons per square kilometer. And then major religion is Islam, 90%. The rest of the people believe in Hinduism, Buddhism, and Christianity. And this is a bit old data, but this is still kind of representative. So we have a strong economy now, and we have graduated, Bangladesh has graduated actually last year to middle income country. And so these are the main economic sectors, service sectors, 56% of GDP, industry 28%, and then government sector. Government sectors play an important role in GDP, which is like total 15% of total GDP. Other sectors, other important sectors is agricultural sector. So still like many people are involved in agricultural work in the country. And the per capita income is US dollar 5,739. Whereas if you compare it with UK's per capita income, it's like nothing. So we are still a very poor country. But Bangladesh has achieved remarkable economic development. And so recently, Bangladesh's GDP was kind of expanding at a 8% per year. And it has a gross domestic product of over 305 billion. And it is ranked as one of the 41st largest economy in the world. And it is forecasted that it could be doubled by the year 2030. So when we looked at like various newspapers last year that were reporting on Bangladesh at 50, they were all kind of highlighting this economic growth and this, like how Bangladesh, which was Henry Kissinger, after the independence era, he was like then the he was a US security advisor, and he kind of labeled Bangladesh as a basket case, which is like, we are so poor in 1971 that he said, whatever amount of aid you provide to Bangladesh will never be like, get rid of poverty, because at that time, 80% of people live under poverty. But we have we have actually achieved remarkable economic development over the years. The other developments that we have achieved is like our fertility rate. So it's 2 or less than 2 births per woman now, whereas it was 1971. And but still there are issues with poverty. So like 37% of urban population lives in slums. But Bangladesh achieved remarkable development in some other index, like Human Development Index. So life expectancy at birth was in 1971 was like 46, whereas now it's like nearly 73. Expected years of schooling has also increased. And if you look at the table B, the Human Development Index, Bangladesh has like even higher Human Development Index value than its neighboring country, Nepal, Pakistan, South Asia. However, Bangladesh has still some issues with this politics and governance. And these are the 2 main leaders. So the woman with glasses, Sheikh Hasina, she is our current leader. And then the woman with pink shari, she is Khaleda Zia, she is the opposition leader. But Sheikh Hasina is in power almost for last, I think, 13 years. She took power 2009 and is still in power. So we are still a democracy, but there are issues in terms of politics and governance. And often these 2 ladies doesn't like each other, and they often kind of argue in front of everyone in the parliament, or Khaleda Zia stopped going to parliament, stuff, things like those happen. However, although we have seen many political dilemmas, political turmoils, the country's economic sector still continuing growing at a high speed. But in terms of governance, there are issues like good governance, and we haven't really achieved good governance the way we are expecting that our government to take care of different things. And they had a kind of dream initially when the country got independence in 1971 that it would be a very secular country and everyone will be treated equally. And so kind of, and the government kind of provide 5 basic needs like housing and health facilities, education, stuff like that. But not everything has been achieved so far. And some of them I would cover in a minute, but before going there, just showing a picture that actually represents the present scenario of Bangladesh. So although different reports and newspaper reports kind of suggested that Bangladesh had kind of graduated to middle income country, the inequity kind of Gini coefficient is still high. So people who have and people who have not, their numbers are really different. Like people who have, they are very few, whereas like most of the people still suffer from kind of low income and other problems. So before I start talking about my conceptual framework, very briefly, my methodology for this paper, because I couldn't go to Dhaka, so what I did telephone interviews. So I interviewed like 14 slum dwellers, and I used my previous contact from my PhD. So I had some of my participants' phone numbers. I actually called them and talked to them. This is how I collected data. And I also did a bit of ethnography. I followed different social medias and did a bit of content analysis of newspaper reports and things. So all this, that's how I collected data last year and the year before. So I thought for this paper today, I'll talk a bit more on pandemic governance and uneven citizenship, because governance is a real issue in Bangladesh. And it's like 50 years, we haven't really improved much. People blame government blames people, but still there are corruption in distribution and things like that. So very briefly, what I meant by pandemic governance, I actually borrowed this from disaster governance. And so disaster governance basically is a concept that people use in disaster, those who study disaster. And it refers like governance that entails unpacking the institutional arrangements that have been put in place for reduce vulnerabilities and exposure during non-disaster times and manage disaster situations once they occur. And here it is important, it's very multidimensional governance concept. So in disaster governance, people believe like it's not only government that could actually contain disaster situation or pandemic situation, rather it's very much multi-governance or multi-party approach. So we need to work with third-party organizations, we need to work with government actors as well as non-government actors, community organizations to contain pandemic like COVID-19 or any other natural disaster. Because some of these disasters, for example, COVID-19, is not even kind of limited to national context. Rather, it's kind of spreading beyond its boundary. So it's important that we also think about global governance while managing pandemic like COVID-19. The other thing is about uneven citizenship that I have used in my research here. And while talking about uneven citizenship, I would start with citizenship and then I would unpack what I meant by uneven citizenship. So the notion of citizenship refers to the rights and privileges of membership in a nation, beginning from the civil, moving to the political, and eventually the social realms. That's how Marshall defined citizenship. But this definition has changed over the years and incorporated the processes of deliberation, collective action, and responsibility to bridge the gap between citizen and the state, by emphasizing citizenship as practice rather than a given. As Lister argues, to be a citizen in the legal and sociological sense means to enjoy the rights of citizenship necessary for agency and social and political participation. To act as a citizen involves fulfilling the potential of that status, placing an emphasis on inclusive participation as the bedrock of democratic practice. These approaches suggest a notion of citizenship where everyone enjoys the right to have rights. However, when I'll present my data in a moment, I'll show how actually people who are citizens of Bangladesh, but they do not really enjoy the similar access to different facilities, as well as their voices are not really heard. And that's the majority of the people in the country. So as they cannot access to although they kind of obey their responsibilities, they follow the government rules, they pay the tax, but in terms of their citizenship rights, they do not really enjoy those rights. So how their rights are denied and why I'm telling that's uneven citizenship is still persistent, and it has kind of shown during the COVID-19 time, like widespread kind of inequality. So I'll unpack those things in a moment. But before going to findings, I just wanted to give some statistics about COVID-19 cases in Bangladesh. So these are from government data, and still people kind of say that government haven't really reported it fairly, or there are issues with people haven't really got tested much. So after all these things, still there are like 2 million people that actually got COVID, but the government shows like most of them recovered, and so fatality rate is like 1.5%. And this is the daily incidence rate, the recent Omicron, as you can see, like the COVID-19 cases kind of decreased, but then from January, because of Omicron, is again rising. And it's almost like 20,000 per day. It's like yesterday's statistics. And this is like the 3 waves. That's how COVID-19 cases have played out in Bangladesh. So when the first case government found in February or March, not last year, 2020, So that was like peak time was end of March and April. And then when the Delta variant attacked in the country, like in April, June last year, and then the third wave is like now because of Omicron variant. And so it's like weekly cases, as you can see, like both when the Delta variant hit and now Omicron, it's like, yeah, the 7-day average is like 14,000 people are getting infected every week. So what government tried to do, they didn't really practice governance when they took initiatives to contain COVID-19 and manage COVID-19. So it was very top-down governance approach. So the government has still like different local government administrations, but mostly decision makers are top-level government officials. Very often, like Prime Minister's office kind of dictate a lot of the stuff. And for the pandemic governance, the government worked with IEDCER, like the Institute for Disease Control. And they have not really worked with other NGOs or any other private organizations to make that decision when how they would like manage COVID situation in the beginning. As a result, what happened when they saw the rise of COVID-19 cases in the beginning of 2020, they initially in March, they declared 10 days lockdown, but they didn't say it was lockdown, rather they said it's a holiday. So people got like a kind of wrong message and people started, they thought it's a holiday. So they started going back to their house, and in Dhaka, especially, many people are poor and many people actually migrated from their rural homes. So we saw a surge of kind of out migration, or like people are planning to visit their rural homes, but the transport was closed at that time. So people actually suffered, and it seems like COVID probably spread because of that decision. And the impact of lockdown at that time was like, from that time onwards, actually, poverty has kind of now doubled from 21% to 41%. So Bangladesh actually did very well in poverty reduction over the years, but then because of COVID, it's kind of going down again. And 70 million people lost jobs immediately. And this number is because a large number of population in urban areas in Bangladesh, they depend on informal work like rickshaw. They pull rickshaw, or they work as street hawkers, street vendors. So when government declared lockdown, all these people, all these informal workers lost their jobs. Garment workers lost their jobs because garment shipment was cancelled. And then even within Dhaka, in the sudden lockdown, nearly 646,000 slum residents who worked in the informal sector lost their regular income. And people didn't have like slum dwellers. When I interviewed them and other people interviewed them, it was found like they didn't have much food left in their house because they often depend on their daily income. For example, Hamida Begum, she is a domestic worker, and she kind of said, and this is a quote that I borrowed from a photojournalist, Muhammad Raqibul Hassan, and he kind of took photos and he actually interviewed informally some of those people, and he kind of showed like how much food they have in a family. So one participant, Hamida Begum, she kind of said like they have only 40 takas at home, and they have to drink poison if they cannot go out for work, and who saved them from hunger. So this was a real issue when the government declared lockdown, because the government didn't really think through, I think, when they declared lockdown, that what would happen for this like large number of informal workers who depend on their daily incomes. And so some of the photos that Raqibul Hassan took from slum dwellers, they actually showed how much food a family has. So in this photo, you can see like, yeah, this family has like this amount of food, and they can, because of lockdown, they are not able to go outside and work. Like if rickshaw pullers were trying to go outside from their slums, government deployed army and police, so they kind of returned them for the initial lockdown. And yeah, this is like the kind of one of the photos when every time government declared lockdown, people actually started leaving the city. And sometimes they had to walk like many miles to go back to other place, or government workers who actually moved to see their families in the rural areas. In the first lockdown, they had to come back and join their work, and they had to walk a long walk when they decided to come back. And research from Prague, this national NGO, they found like 18% of urban and 10% of rural respondents respectively had no food stored at home, while 37% and 21% respectively had only enough food to last 1 to 3 days. And this is a photo from the slum where I kind of did my PhD study, as well as like I did my data collection for my PhD, and later I also collected some data for my COVID-19 project. So in terms of food and other services, people suffered a lot, but other than food, people also suffered a lot while accessing health services. Some of the problems that people encountered while accessing health services, because Bangladesh's health system was never really equipped to manage cases like COVID-19. We didn't have that many ventilators or that many ICU beds. And there are few government hospitals in Dhaka especially. So and in Dhaka, the population is really high. So when people got COVID, many people, especially those who are poor people, they kind of were denied to admit in the hospital in the first kind of wave of COVID-19, because it was very stigmatized at that time. Doctors were really afraid that they would get COVID or other patients would get COVID. So they keep denying people to admit to their hospitals. And slum dwellers also didn't go for healthcare facilities because they had, there was not much advertisement or campaign about COVID-19 initially. So people saw some advertisement on television. And I'm not gonna show videos. Videos would have been probably better, but I think with the Zoom, it's kind of sound quality is really bad if I show. So I'm not showing you any video, but there are some good videos like how the government showed COVID-19, how they kind of run COVID-19 campaign, and then what happened, how people experience social stigma. And some of them are actually in English. For example, this link for the YouTube video on social stigma, it shows like why poor people did not even go for treatment. Because if in a slum, as I showed you in the previous slide, the houses are very close and dense and people live very close by. So people are always afraid that they would get COVID from other people. So they would kind of ostracize the family if they know that they got COVID. And so when I interview people, they keep kind of denying that they have any COVID case in their slum. Rather, one of my participants said like, this is a kind of rich man's disease. So because the slum where I did study is called Shatala slum, and it's near an affluent neighborhood called Gulshan and Bonani and Niketan. So they said like, the people nearby Gulshan areas, they have got COVID, but the slum dwellers, they do not have any COVID cases in their slums. And they also told me like they kind of taken on their own initiatives so that they do not get COVID, like they're not going outside and they're maintaining social distancing, stuff like that. So that's kind of my next point, that how kind of non-government organizations and community organizations work together to contain COVID cases, to manage food shortage and other stuff. But before going to that, very briefly, what kind of strategies government took to provide aid to the poor people? So one of the initiatives government took in 2020 is known as open market rice sale, where government was trying to sell rice at a lower price than the market price. But what happened at some point, poor people and hungry people who are very hungry, they kind of attacked the convoys where the government employees were selling the rice. And so government stopped selling those rice. But there were also concerns like there would be people who are government followers. They were like stealing rice. And so what happened on April 6th, the government launched a special open market sale operation because of the lockdown. So government wanted to like kind of manage the situation that there's no food shortage, people do not really get hungry and get mad. So they took this initiative. But what happened? People, despite hungry people, attacked the relief convoys, and others who asked for food notes, they were also attacked, as were some journalists who covered the misappropriation of food aid because it was not really distributed properly. So sometimes they distributed food items among their followers, political followers, and that happened in other cases as well. So the next thing government did, they kind of announced some stimulus packages, and one of them was particularly for poor people, low-income group people, and that was like they would send 21.45 pounds, which is like 2,500 taka, to poor families. But what happened later, the journalists, they reported that the beneficiaries, although they were supposed to be floating populations, rickshaw and van pullers, day laborers, ferry and dock workers, and other street vendors and other poor people, they did not really receive that amount of money. Rather, the problem was that local administration and elected representatives identified the beneficiaries. And so they kind of manipulate beneficiaries, and they kind of put some of their followers' name, political followers' name, in that beneficiary. And this is a news report from the daily newspaper called Prof, and it actually shows, if you read this one, that this is a case where it shows like how government aid has been not properly distributed among the poor. Rather, political like the follower of Army League, the current ruling party, their followers actually got many of these things, and they are not even poor. So the vice president of Russia's City Kishak League, which is like a kind of branch of Army League, the ruling political party. So he is a well-known to-do person and earns a good amount in rent from his shops in the Lokhipur market. But then he received the cash assistance, and the program was like, it was transferred to mobile finance system called Nogod and Bikash. So people just automatically got the aid, but that doesn't mean like those who are poor, they got it. Rather, there was like huge kind of misappropriation of this fund. And based on that, like they reported that Omotoshan won his Nobel Prize on the issue of discrepancies, not the shortage of food, leading to famine, which is like, the Bengal famine long back. But then nearly 50 years have passed since that independence of the country, but Bangladesh has not been able to shake off the glitches in this distribution system. On the contrary, the problems have grown all more acute. So even when Bangladesh got independence, the first Prime Minister, Bangabandhu Sheikh Mujibur Rahman, he also commented on that, like there was a issue, like he was distributing blankets among the poor people in rural areas who were like very poor and not kind of able to afford blankets. But then his political followers actually took all those blankets and they didn't really deliver. So even after 50 years, we see similar cases, even when we are trying to manage COVID-19 situation and trying to support people because they lost their jobs. So kind of government tried, and Prime Minister Sheikh Hasina was kind of very adamant that she would punish if any kind of corruption she finds out while distributing aid, but it still happened. And I haven't read much information on like how they have treated those who are kind of engaged with misappropriation of aid. But the finance division basically closed that program, and there were like, how many cases? Let me tell you. Yeah, so they were like investigating a number of cases that people actually didn't get the money, and it's always like well-to-do families, they got the money, which was supposed to be received by the poor families. But non-governmental responses was really good. So various NGOs, because they work in both rural areas and urban areas and urban slums, they also kind of motivate people. They kind of form different community organizations within slums. So they use their local community members to raise awareness. Like when I interviewed some of my participants, they say like their local NGO officials, they had a training with them, and they kind of teach them like how to maintain social distance. And there was like UPPR, which is a kind of UNDP-based project. They also provided some water taps in slum areas, and some NGOs provided 5 bars of soaps and masks to people so that they could like wash their hands properly. And there were like other things that the community members did by themselves, because in slum, in a house, there might be 20 houses and there might be 2 ovens for cooking. So I asked them like how they're maintaining social distance. So they kind of said like, yeah, so they take turns when they go for cooking. So they took their own initiatives, and then those who were like landlords in the slum, they kind of didn't pressure their tenants to provide rent during the lockdown period, or like during the COVID time when the situation was not really good. So they took all these initiatives. They also identified who are the like poorest of the poor within their slum, and then when government or non-government organizations providing aid, they provided the list to them so that those people could get the aid. And in terms of food distribution, they also say like, if they are landlords and they have some sort of savings, and if they see that their neighbors cannot eat, so they distributed their own food among their neighbors. Similarly, different like community organizations and NGOs also provided food among slum dwellers and other organizations. And so this is a photo where you can see, and this is a private kind of initiative that people are distributing food among the poor people. And so this is an old picture, but this picture also shows like it's hard to maintain social distancing in a slum. And as a result, kind of, we assume that COVID-19 has spread a lot in the slum. And that's what IEDC, they did a study and they found recently, like most of the slum dealers actually had COVID, but they didn't go for treatment. So yeah, it's like all untested cases. So to sum up, I think I have 5 minutes, so I'll just sum up. So I'll go back to 1971 and start from there in the conclusion. So in 1971, Bangladesh was born as a kind of new state with a dream to establish a just society. A society where everyone, not only those in power, could enjoy the benefits of development. In the past 50 years, Bangladesh has achieved remarkable success in its economic growth and on the notable development indicators. It has also experienced devastating cyclones, famines, and other disasters and managed them well. Yet the distribution of COVID-19 aid shows that Bangladesh has not progressed much in terms of looking after its poor populations. The nation's pandemic management strategies further revealed that the government is still hesitant to work with NGOs, including civil society groups, community-based organizations, trade unions, and other voluntary organizations, who kind of played an important role to provide aid and kind of make them aware about COVID-19. The non-governmental sector also plays an important role in the country in providing microfinance, education, and health services, and has established networks in different parts of the country. But the government did not initially consult with NGOs or use their resources to prepare the National Preparedness and Response Plan for COVID-19 in Bangladesh. Bangladesh followed the Western model of using lockdowns initially to contain the spread of COVID-19. However, developed nations have strong economic bases and can provide better social safety nets for their disadvantaged populations. Bangladesh was unable to provide the minimum daily wage to its poor citizens during the lockdown period. And corruption in the health sector and the difficulties that the urban poor face in accessing health services show further how a state can promote health inequalities through its system. Social stigma associated with COVID-19 has made poor people more vulnerable and deterred them from visiting medical facilities or seeking care. To deal with pandemic-related stigma, the government needs to work with local religious and community leaders and local NGOs to provide accurate information about the disease as well as disseminated in the local languages. It would also be helpful if local governments and local NGOs inform slum communities about the nearest COVID-19 testing centers, because many of the participants whom I spoke to, they're like, they don't even know, like, where is the testing center? How do they get tested? So, and the government needs definitely to work with NGOs and other community organizations to properly distribute aid, no matter how much it's like they are distributing, whether it's like 25 pounds or more than that. Because if the government only distributes through its own administrations, there will be like corruption and people will not really get those money. So finally, to sum up, Bangladesh needs a socially just model to beat this pandemic that requires effective partnerships between government, NGOs, and community organizations. It also requires an understanding that the structural barriers are widening and creating division between the haves and the have-nots. That gap must be minimized, not only to tackle the pandemic, but also to establish a just society. To build a just and developed country, the government of Bangladesh needs to ensure that the dividends of development are not just enjoyed by the elite, but it benefits all citizens. Thank you. Oh, and these are some of the publications that I have published and forthcoming from my work. So if you're interested, reading more about this, you can find them. Thank you.
Thank you so much, Lata. Would you be okay to stop the screen sharing so that we can see each other for discussion? Thank you. That's great. Anke, is it all right if I ask a quick question before I hand over to you?
Totally, yeah.
Cool. Thank you very much, Lata. That was really interesting and really rich. And I have a lot of questions forming, but the one that is kind of at the top of my mind is you started off talking about these measures of you started off talking about some of the ways in which this kind of Bangladesh success story has been narrated in terms of better development index performance than some neighboring countries. And there's a lot of development studies literature that attributes those improvements in part to the NGO sector. And then also a lot of recent literature that kind of questions what happens to the NGO sector as it became professionalized and maybe less radical in certain spaces. And I was wondering, you mentioned some of the big organizations like BRAC in relation to data collection and ICDDRB doing research and I think testing, as well as all these community organizations that emerged. And I was just wondering if I could ask the kind of pandemic governance you saw or that you are writing about. In your recent paper, you draw on this disaster governance idea of bringing together multiple organizations to manage risks, thinking about the institutional arrangements put in place to manage vulnerability during non-disaster times. Did the pandemic and the lockdown, was it marked by a continuation of a failure of government to work with NGOs and a disconnect between the big aid NGOs and the local community NGOs? Or was there a kind of change during this lockdown that broke some of those links? Like, is this a problem of the pre-existing NGO government relationships, or was it reformulated through the pandemic response?
Thanks, Paul. Great question. Yeah. So, I actually know about a lot of like government NGO tension in Bangladesh context, but I think it has improved a little bit, and especially during the COVID-19 pandemic. I know some of the cases because I know Asif Saleh personally, who is like probably now Prague's director. But so I read some of his kind of comments or some of the work Prague is doing. So I feel like government did a little bit of work with Prague, especially, I know. So they kind of, when they were sending money to Bikash, is kind of Prague's product. So they use Bikash. So that's the kind of relation. And then Prague also doing like a distributing mask, but that's a different thing. I think that's not related to government, but they got some funding from the US, and so they're doing that. They're delivering masks among mass people. But government did some work with NGOs like Prague to manage pandemic, which is a good sign, I would say, but not like, it's a kind of different system in Bangladesh. So government doesn't really go beyond government organizations. So whatever amount of work they did with NGOs this time, I definitely appreciate that they kind of break their boundaries and work with NGOs a little bit. Thanks.
Thank you. Anke, should I hand over to you for a bit?
Yeah. Thanks. Thank you so much, Lata, for a really interesting talk. And I think it reminds us that the pandemic is by no means over, even though here in UK, the government wants us to believe that it is. But kind of seeing the cases going up again in Bangladesh, I think is a good reminder of the global nature of this pandemic. It was really interesting for me to hear about how your fieldwork shifted and how you obviously, without being able to go back to Dhaka, were able to use kind of pre-existing connections and do phone interviews, and then also shifting to social media accounts. And partly I'm saying this, I know, because Belen is here, who was one of our PhD researchers who was in India and had to kind of leave, and her research was really disrupted because of COVID. So I think it's interesting to see in your case what strategies you had to get this really kind of current information, even though you weren't able to be physically there. I think your two kind of theoretical frameworks, pandemic governance and uneven citizenship, are really interesting. And I think my main question is kind of similar to what Paul was asking, and this is partly you seem to be arguing that things were slightly different, right? Pandemic governance, it was more multi-governance because the government realized it couldn't do it all on its own, and it did work, as you just said, to some extent with NGOs, maybe more so than it would have done before. And similarly with uneven citizenship, and I really like the way you use kind of Lister's definition, which is much more about the substantial and the kind of the embodied component of citizenship that goes beyond, the formal rights that we have because we have a passport. It's about a feeling of belonging, but it's also about a sense that we can enact citizenship rights, and that especially marginalized people feel like their voice matters, they're being listened to, and they're actually being part of a nation state in a really substantial way rather than formal way. So I really like this definition. And then you said that during the pandemic, people didn't enjoy the citizenship rights, and you showed kind of the really dramatic effect in terms of, poverty rates doubling because people were prevented by the army and the military to go about making a living. Access to hospitals was severely limited for a number of reasons. And one of the questions I had, and it came up for me when I read the quote by the journalist about the distribution system, to what extent was this really new, or to what extent was this actually continuities of existing exclusions, right? For example, of people who live in slum areas in Dhaka. So what was new about the pandemic and the way it curtailed citizenship rights? And what was actually a continuity of pre-existing exclusion? So for example, would slum dwellers have had better access to hospitals before the pandemic, or would they similarly have had the social stigma of not being able to go to the hospital, right? So I want to push you a little bit more about what was new and what were some of the continuities. As this journalist said, you know, the distribution system hasn't really been working since 1974. And the corruption and the nepotism in the distribution of food aid, for example, was not something that was new, but was maybe kind of highlighted or reinforced because of the pandemic. And then a couple of smaller questions. You talk about the big outmigration into rural areas. And of course, we saw all the images from India, and we heard the stories about how people were stranded and in terrible conditions. So it's interesting for me to see that something similar, maybe not at the same scale, happened in Bangladesh. And then I'm just wondering, did that to some extent shift the problem from the urban areas to the rural areas? Because you said even in rural areas, people didn't have access to food. I would imagine that relief efforts were probably even less effective in rural areas. All of a sudden, you have a massive influx of people. So, you know, to what extent was the problem displaced from cities into the countryside? And maybe you don't have that information because your research was in Dhaka. It's just something that came up for me. And then the last question is about this app, right? You mentioned Pcash, the Prakash. I'm just wondering if the food distribution, if the money automatically went through mobile apps, and you said people automatically get the money, again, did that exclude certain groups, or is the BRAC mobile app really as widely available, and are, you know, most marginalized? Are they part of the system, or kind of using a mobile app? Would that have introduced new exclusions and kind of actually left out the people who, you know, might have needed the money or the food aid the most? So just lots of interesting questions that your talk provoked for me, and I'll leave it at that for now. But thank you again for your really interesting talk.
Yeah, thanks, Anke. So I might start with the last one. So about Bikash, yeah, I think Bikash is really popular. And in terms of digital inclusion, it's interesting that even like a very rural setting where there might not be, I think in most villages now have electricity, but even like very remote villages, villagers have mobile. And I think Bikash is very popular, and Bikash is also popular because you probably know that in Bangladesh, many, especially from rural areas, people often migrate to abroad, and then they earn money and send back remittance. So that's how like Bikash got popularity in remote rural areas as well. So that's a good way that the government transferred money. The problem is like who actually received the money. So your second question about rural areas. Sorry, I wanted to mention that. So actually, social security programs, there are not many in Bangladesh, but whatever we have is more like rural focused. So it's like rural people have actually more kind of social security, or like elderly people in rural areas, they get money from government. So they have better social security than urban poor. So, and in rural areas, they also like kind of, they could at least have some sort of vegetables on some sort of natural food that they could afford. Whereas in cities, they have to buy everything. So that's the other thing, they kind of could escape hunger, I guess. And your first question, sorry, remind me, I forgot your first question. But I remember now, you asked about like existing inequality and like excess. Yeah, so I think the pandemic has kind of shown or kind of increased that inequality. So poor people could access hospitals or like health services, because there are many public hospitals and they usually go for public hospitals. But in public hospitals during COVID, there are not many ventilations or there are not many ICU beds. So people who actually need ventilations or ICU facilities, they had to spend a lot of money, and that's like upper class people could afford that. So that's the other thing. So if poor people, they try to go to a private hospital, they won't probably admit them anyway, because they could just understand that they will only be able to provide the money, the pill at the end of the treatment. And so that happens, but usually people can access government hospital facilities, which is good. It's kind of very free or very little amount of money they have to pay, but they do not always use that service, because when I did my PhD fieldwork, I actually asked them about some of these health facilities. And partially because the hospitals are not where their slums are, so it's a bit far. Like Dhaka Medical Hospital is near Dhaka University, whereas Shatala slum is it's a bit far away from Dhaka Medical College, so they have to pay money for transport and stuff. So sometimes they just use their local doctor, local doctor. Mm-hmm. So that's how, but they could access health facilities in other times. So I think during pandemic, it kind of increased the problem more. But I agree, it's the existing, that's why I said the structural problem needs to be fixed. So it's not really something new, it's kind of continuing the previous issues. Thank you.
Thank you.
Thanks, Lata. I have a couple more questions, but I thought it might be nice to open it up to anyone else. So I know there's a few people from Sussex who work on related issues around urban precarity and so on. Does anyone have any thoughts or questions for Lata? Need some more time to stew. I just want, while I'm waiting for people to put their hands up, or if I can't see your hand, just call out, sorry. Yeah, I was one of the things Anke was mentioning is about the policing and the army during lockdown as well. And it was making me think of Nusrat Chowdhury's work on citizenship in Bangladesh. The kind of idea that a repressive state blames its, the state apparatus is blamed for the inadequate political rationality of the citizens, which is then justification for curtailing the citizenship rights. When you're thinking about this uneven citizenship, obviously a lot of what you've been talking about is kind of access to services, access to redistribution programs and so on. Was there a very clear unevenness in terms of how people were policed? Was the policing happening just in the main roads of Dhaka, stopping like rickshaw drivers, or were people actually, you've written in some of your other work about policing the Nikaton Gulshan areas for slum dwellers seeking a livelihood. Was there actually an extension of the kind of state apparatus into slums, or was it just preventing movement out of slums? I'm not sure if you managed to talk to people about that.
Yeah, I have a little bit of idea about that, Paul, actually. Yes, it's like, some of the things initially, and most of these things happened when the first lockdown declared in 2020, March, April. So that lockdown was a bit hard, but then later lockdowns are people don't really follow that much. But so initially what happened, there were police and army and slums, and they kind of told people not to come out from the slums and police them. But I also heard that people who are from Gulshan and Varnabeni, they can use their cars and police don't really stop them when they move from one part of the city to another part. And stuff like that. So still there are some issues as well, like whom they are allowing and whom they are not allowing to move freely. That again shows like how citizenship is uneven.
Right. And that's, I guess, another continuity, because there's always been slightly different treatment for the residents of some of those areas. Has that, thinking about your other work on sort of public space and right to the city, has the pandemic, like, do you think it has had a long-term change on the right to the city, on the right to livelihoods in the city? Like, is the ability of informal workers to have, be informal sellers and so on in the street, is that forever changed, or things kind of going back to some kind of pre-pandemic norm?
Yeah, I think it's going back to
Right.
some sort of pre-pandemic norm, because as I have mentioned that we don't really have strong social security system, and government has not really provided any other stimulus package since like 2020. So it's like they declared some of the stimulus packages during different budget last year and last 2021 and 2020. But then most of those packages were directed to business, micro business, which does not really cover informal economy. So so people have to work because government cannot feed them. So government has to be a bit relaxed and allow people to work whatever way they can earn their earnings.
Thank you. Any other questions or comments from other attendees?
I have one, if that's all right, Paul.
Yeah, go for it, Ben.
So thank you, Lata, for the talk. I thought it was really illuminating and just kind of underscores the importance of wider social welfare policies during health crises, right? Which is not always an immediate thought, and the way in which health crises amplify inequalities, which is powerfully illustrated by your work. It's I guess the one of the questions I had was around sort of that aspect of the inequalities, which I think you touched on a few times, and I don't know whether you can say more about it, but it's actually kind of breaking down some of the inequalities and thinking about the kind of within group inequalities and whether there was, for example, gender differences in the experiences that people had within the slums, for example, whether that came up much in the data that you had, or other kind of socially patterned experiences along the lines of religion or caste, and to what extent that kind of featured or not. Is there more you can say about that at all?
And thanks, Ben. So I think in terms of gender or religion played less a role because there are not many Hindus and Muslims in Islam, so it's mostly Muslims in Islam. But in terms of gender, I think there were like a bit more flexibility in terms of like women who were domestic workers. They could probably move a little bit than male rickshaw pullers during the lockdown period. And women, they were also more like, because NGOs often use women groups to form community organizations or like community leadership. So it's more often women. So they were like kind of a bit more vocal. And some of the NGOs use them to list which are the groups or which are the families they need income support more than other groups. So I think they played an important role during the pandemic. So that's kind of my observation.
Thanks. And did it kind of allow? I did wonder, kind of, weren't people angry about all this? Were there, I'm sure they were, right? But they kind of you mentioned some forms of mobilization, but it didn't sound like, it sounded quite, from the way you presented it, it sounded a bit like a lot of people were sort of passive within the relationships, that it was sort of NGOs running things and people were recipients. Was there not kind of, I don't know, like more of a sort of a pushback against some of the government policies and ways that people found kind of around them, and the kind of, the kind of agency and mobilization that we often see when people are marginalized by the state?
Yeah, that's a great question, Ben. My PhD supervisor used to push me about that. And so I had to always answer that, like India and Bangladesh are two countries, and Indian people are very much resilient. They have very much kind of revolutionary spirit, whereas Bangladeshi people are very kind of passive, so they don't really fight back. So it's like, yeah, so that's something interesting, but that has a kind of historical legacy. Like partially, some writers say it's because of the NGOs, and what happens since 1971, NGOs played important role in mobilizing and like in providing microfinance and stuff like that. They did a lot of wonderful activities, but some of the NGOs initially also tried, because when we got independence in 1971, one of the principle was like it would be a socialist state, and then Sheikh Mujib didn't go or like follow that, but then different communist groups actually pushed him to kind of establish a socialist society. So there was a kind of historical issue over there. And as a result, what happens, some of the NGOs initially were like, socialist NGOs are like, they tried to mobilize rural people against government's repression or different policies. But then that's how actually government's relationship with NGOs were kind of bad. That's when it started. So government stopped kind of trusting NGOs, and now government has a kind of NGO registration board, something, I forgot the name, but there's a registration board where all NGOs has to register. And then government also arrested one of the NGO kind of director who, he was a very kind of, he was a good leader, and he tried to put someone from a rural area as opposition to the ruling political party's candidate. So those things happened like 1975 onwards. So yeah, so that's the story. And so what happens when the microfinance and other NGOs started providing microfinance and other facilities, I think partially the spirit of like fighting back, it somehow lost from rural people or like the repressed group. So yeah, some authors say just did a good job, but then at the same time, I think we lost our spirit because of some of those activities.
That's really interesting. Thank you.
Actually, can I jump in here because Sarah Jane, did I see your hand up?
Yeah, but you go. I'll go after. Don't worry.
Yeah, no. It's just because I've done a bit of research on microfinance, Lata, and I actually did some research into kind of Mohammed Yunus and then his role, right? And he tried to had a political career, which I think was very short-lived. But I know Lamia Karim's work, and right, she talks about kind of the pacification that happened because of NGOs. So maybe that's partly what you're getting at. But in terms of microfinance, I would imagine that a lot of people would have fallen behind on their repayment on their loans and stuff. Do you have any sense, was there kind of did microfinance organizations give people a break? And that might not be being specific about your research, but because you just mentioned it, I'm just wondering that financially, if people had taken out loans and stuff and all of a sudden there was no more income, that, again, must have had really negative consequences. Was there some adjustments? Is that your sense? Or maybe you just can't answer this because it was outside of your research?
I mean, I haven't directly done research on that, but I read work on people who did work on microfinance. And I think there are both positives and negatives. And the negative sides are like, basically, the interest rate is very high. So when they provide microfinance, immediately, it's not like you're going to set up a shop and you will have immediately a lot of money profit that you could pay back. So that's one of the critiques of microfinance. And I think that's probably still true. I don't know how Grameen Bank operates in Bangladesh now, whether they change their microfinance policy. But yeah, that was like the main criticisms of microfinance and Muhammad Yunus. And yeah, you know about his political career. It's just a mess. Anyway, thanks.
Thank you.
Yeah.
Sarah Jane, did you want to?
Yeah, thank you. Yeah, this I guess kind of aspect that both Ben and Anke were talking about with I guess both resistance and kind of risk and how that plays out during the pandemic, I found really interesting. And I was thinking about I guess recent organizing among garment workers and how there's obviously like a lot of, you know, like that's a much longer term arc, but then the systemic nature of COVID and just kind of shunting risk down into people's lives and you know, basically kind of shutting down already very precarious working conditions and wage theft and all of those things. I don't know if that it was something maybe, as you said, geographically with your site, maybe it wasn't kind of somewhere where garment workers were or where that would have impacted people's daily lives. But I guess just in terms of that kind of idea of organizing and how people channel back into their kind of other citizenship rights of whether or not they're able to advocate for their labor rights, how that, I don't know, how this maybe felt different during COVID or felt similar to previous kind of debates around that.
I think garment workers are a bit more organized than other informal workers because they have kind of formal organizations to protest when every time they do not get their pay on time and things like. So they are more organized than any other categories of like informal workers. So I think during COVID time, their protest actually worked, and government kind of provided some money to garment owners because they said because of all the shipment cancellation and stuff, they had a loss and they are not able to pay back the garment workers. So government kind of paid some sort of subsidy for the garment sector. But yeah, that's a good way to protest. But it's kind of sad, like that's their rights. They're working for their wages and still they do not get the wage, which makes me really angry. But at least they did some movements and most of their movements are successful. So there is hope, and we hope other worker groups would be able to mobilize themselves like garment workers.
Thank you. Any final questions for anyone or anything you wanted to add, Lata?
No, I'm good, thanks. But yeah, thank you again for inviting me, and thank you everyone for joining us today.
Thank you so much for joining us at what I guess is about 8:15 in the evening for you. And it's very difficult to find a convenient time across the UK and Queensland. So I really appreciate you talking so late. And really fascinating work, and looking forward to reading I saw you've got a few more things coming out soon. So I'm sure I'm not alone in looking forward to following that work coming out. And for those of you still here, and even for Lata, if you're interested, I know that some of your recent work on pandemic governance, and you drew on this idea of collective life in urban centres of the Global South from Abdul Malik Samon and colleagues, and Abdul Malik will be sort of keeping the theme of this series going, speaking on the 23rd of March. So if it's probably a horrible time for you, Lata, but we'll try and record it. And,
yeah. Thanks. Yeah, I was interested to attend some of the speakers, but the time is like so different. I'm like, I can't really wake up in the middle of the night.
Yeah, well, we should be recording them like we are this one, and there is a YouTube channel now that our first one from that Arias is on. And also for people here who might be thinking of coming next week, it's been sort of suspended next week. Trevor Ngwane obviously doesn't want to cross the picket line, but he has offered to come back and talk to us after the strikes about thinking through strikes from a Global South perspective, as a South African union organizer himself. So that will happen at some point. But not next Wednesday. But yeah, thank you so much, Lata, and I'm sure we'll continue to have thoughts and discussions from your work in the department, which has really been really informative and really rich. So thank you very much.
Thank you everyone. See you next time.
See you. Bye.
Thank you. Bye-bye.